There are 2 assessment units, one at North Tees and one at Hartlepool. The units provide a service to antenatal women from 14 weeks pregnant onwards and into the postnatal period. You can self-refer into either of the units, however, it is always advised that you contact them by telephone before you attend to enable one of the midwives to assess both you and your baby's needs. The Maternity Assessment Unit at North Tees is on the ground floor and situated in the women's outpatients. The waiting area is spacious, has a water machine for patient use and a children's play area. The assessment unit is located past the waiting area on the right hand side and has a reception area where you can hand your file in to let staff know that you have arrived. The maternity assessment at Hartlepool is also on the ground floor of the hospital. It is situated next door to the birthing centre. It also has a large spacious waiting area and a reception area where you can clock in. Both assessment units have curtained bays with an examination couch and an armchair. The units also have access to private clinical rooms if one is required. Both units display a range of topical information that may be of interest to women, partners and their families during their time within the units. Your community midwife may advise you to attend one of the units if, during a routine visit, a problem is found. This could include a change in your baby's pattern of movements, finding that your blood pressure is higher than normal, or if she is concerned about your baby's growth. If you are required to be seen by a doctor, you may be asked to attend North Tees, even if you live closer to the Hartlepool Hospital. Both assessment units use a triage system, which means that all patient care is prioritised based on a patient's condition and how urgently they need to be seen. The length of time you may wait can vary and the units are often busy. Unfortunately, this cannot be avoided, but a member of staff will inform you of any waiting times if there is any. If you have been referred for consultant-led care, you may be asked to attend a clinic appointment where you may be seen by a specialist midwife, a consultant, or one of the medical team. If you are attending the assessment unit, you will initially be seen by a midwife. Depending on this assessment, you may also be required to be seen by a doctor. In most cases, following appropriate investigation, treatment if required, and advice, you will be able to go home. If you have tests during your time on the unit which require treatment and you have been discharged, a midwife will contact you directly. Occasionally, some women may be advised to stay in hospital to be closely monitored or for further treatment. The team will make further arrangements for your admission on the antenatal ward or delivery suite. If your community midwife is concerned about your baby's growth, you will need to attend the women's ultrasound department on the ground floor. Our aim is that one of the midwives will scan you in the midwife-led ultrasound clinic. They will review your baby's growth and ensure a plan is in place for your next appointment. However, you may also be required to have routine growth scans during your pregnancy for a variety of reasons. The sonographers will check the health and growth of your baby, then you'll be asked to attend either your clinic appointment or the assessment unit. You must always be reviewed following a growth scan, even if you have been reassured by the sonographer that everything is okay. North Tees and Hartlepool was recently acknowledged as one of the top 10 trusts in the United Kingdom for the detection of babies that are not growing as well as expected. Thank you for taking time to watch this video on behalf of North Tees and Hartlepool Maternity Assessment Units.